Good morning, ma'am. I am Nurse Angel. May I know your name? My name is Pablo. So I am going to assess your thorax and lungs for possible abnormalities. Can I? Okay. Next is to perform hand hygiene and observe other appropriate infection control procedure. After that is to provide for the client privacy. Ma'am, can I ask you some questions? These informations will be used to properly assess your thorax and lungs. Okay. So, do you have any family history of cancer? None. Allergies? None. Tuberculosis? None. Lifestyle habits such as smoking? None. And occupational hazards? None. Do you have any current problems such as coughs, swelling, wheezing, or pain? None. Thank you, ma'am. So, for the assessment of the posterior thorax, first we must inspect the shape and symmetry of the thorax from posterior view and the lateral view. So, I noticed that the thorax of the patient is symmetric. Next is to inspect the spinal alignment of the posterior thorax for any possible deformities. From the lateral position, we have to observe the three normal curvatures, which is the cervical, thoracic, and lumbar. So the spinal column alignment is straight and the shoulders and the hips are at the same height. Next is to palpate the posterior thorax for temperature, tenderness, or any possible deformities. We have to avoid this palpation because it could lead to displacement of the balls on the lungs. So the skin and the chest wall is intact. There is no tenderness or masses and the temperature is uniform. Next is to palpate the posterior thorax for respiratory expulsion or thoracic expansion. Please take a deep breath. Again. So the thoracic expansion is full and symmetry. Next is to palpate the posterior thorax for vocal tactile or fremitus. We just have to ask the client to repeat words such as blue moon, 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 blue moon. So, vocal fremitus is bilateral symmetry and the fremitus is clearly heard most in the apex. Next is to percuss the thorax. This will determine if the underlying lung tissue is filled with air, liquid, or solid materials. You just have to ask the patient to bend her head and fold the arms across the chest. In percussing the thorax, we have to start at the apex of the lungs. So that's how you percuss the thorax. Next is to auscultate the thorax using the diaphragm of the stethoscope. Take a deep breath. the assessment of the posterior thorax, we can now proceed to the assessment of the anterior thorax. First, we must inspect the breathing patterns of the client and the costal angle formed by the intersections of the costal margins.
Ano kulay ng tank?
Okay. After that is the assessment of the costal angle. Please take a deep breath. So, the client has a quiet, rhythmic, and effortless respirations, while the costal angle is less than 90 degrees. Next is to palpate the anterior thorax for the temperature and tenderness. We must avoid deep palpation because it could lead to displacement of the bone. Next is to palpate the anterior thorax for respiratory expulsion. Please breathe deeply. Again. So the client's respiratory expulsion is full and symmetric, and the thumbs normally separate. Next is to palpate the tactile fremitus. We just have to ask the patient to repeat the word blue moon. 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 So, same as the posterior thorax, the fremitus is clearly heard at the apex of the lungs and is normally decreased over the heart and the breast tissue. Next is to percuss the anterior thorax. Next is to auscultate the trachea. After that is to auscultate the anterior thorax over the bronchi between the sternum and the clavicle, and ask the client to take a deep breath. Please take a deep breath. After the assessment of the anterior and the posterior thorax, we can now document the findings on the client's record.